Welcome back to Afternoon Live. Whether it's prescription medication or over-the-counter supplements, most of us take some sort of pill regularly, so it's important that we are doing it correctly. Here to bust some common myths about medication, we welcome pharmacist Dr. Sue Ojageer. Thank you so much for joining us.
Thank you so much for having me on. It's a pleasure to be here.
We're going to bust some common myths today, starting with one that all medications are quote-unquote safe, and this is kind of particularly about things that are over-the-counter, like vitamins and herbal supplements. You got to know what you're getting yourself into.
That's a great one to start off with. First, we think that medications that are over-the-counter, particularly the herbal substances and our vitamins, are safe because it's so easily accessible. It's right there for us to purchase, and we can just grab it off the shelf and just get it at our convenience. But in fact, these medications, when taken with our current medications, could have serious side effects with commonly, such as our blood thinners. There's a huge interactions for a bleeding risk, so it's very important for you to always consult with your pharmacist before beginning anything that's over the counter.
That's a great point. You have a resource available. Your medical provider, your pharmacist can always help guide you through decisions over if you're trying to add something to your routine. Okay, number two, this myth here, all medications should be taken with food. That's not true across the board.
Not true for everything. In fact, the majority of medications, it is common to take it with food, but certain medications require an empty stomach for it to be at full potential to work the best. Medications such as our proton pump inhibitors that help reduce the acid in our stomach, bisphosphonates that help with osteoporosis, thyroid medication, those require you to have an empty stomach for it to show the full potential.
Are there varying degrees of, I guess, how full your stomach should be depending on the medication? Is a light snack okay for something versus maybe a full meal would be better for something else?
1 to 2 hours is the recommended time frame. First thing in the morning would be best to start off when as soon as you wake up with a full glass of water. So that's the time frame that's usually recommended.
Okay, our myth number three here, you should stop taking your medication if you feel better. That can be really dangerous.
That is a dangerous one, and especially for those medications that are for our diabetic patients, our hypertensive patients, and cholesterol medications. You don't really see the full effect, or you're able to gauge the response of how these medications are working. So most patients calmly stop taking it because they don't see a result in front of them happening. But it's really important to continue because they are still working, and you don't want to stop taking any medications without having that consult. And another one that's important to mention is our antibiotics. You don't want to stop taking your antibiotics because, in fact, if you do so, you start building resistance to bacteria and makes it harder for you to fight infections down the road.
Yeah, that's a big one. I've also heard anecdotally people thinking about going off of things that they're maybe taking for a mental health issue that, well, I feel so much better, so I can just wean myself off of this without consulting the person who who prescribed it to me.
Good point. Very good point there.
Okay, let's see here. Myth number four is that all medications work the same for everyone. Oh gosh, we just know that's not true.
That would be the best case scenario in the perfect world for having medications that work across the board for all of our patients. But in fact, there's so many factors we have to consider when taking medications and prescribing to our patients. For example, there's factors such as weight, age of patient, the clearance of the medications when they're excreted out of the body, your kidney function, your liver function. And if you want to go into further details, there's a specific area in pharmacy called pharmacogenomics where we get into drug genome interactions, and precision medicine is a great way to help tailor medications personalized for patients based on their genetics.
Oh, that's fascinating. Okay, which kind of brings us to myth number five, the myth about the profession of pharmacy, that pharmacists really only work in retail or hospital settings, but there's just so many different forms of pharmacy.
That is one of the biggest misconceptions that we think of pharmacists, especially with the profession. We commonly see pharmacists in our community settings. We hear about them in the hospital settings, a few in the industry, but in fact, there's numerous ways that pharmacists provide care to patients, provide patient care. There's over 50 different specialties that pharmacists work in, and many, many ways that we help our patients.
What would you say, what advice would you give to somebody young in their career, maybe thinking about pharmacy as a goal? I know it's a really rewarding, but can be a tough job a lot of times.
There are a lot of resources out there. There is a mentorship site that is available, pharmacymentors.com, that provides additional support and mentorship services where you could connect with pharmacists who are working in particular specialties and fields, and you could get your questions answered directly from these professionals who are practicing in that specific area. Tons of resources out there. I know it does get a little frustrating, especially with a lot of things that you hear in media and online on social media as well. But if you stick to the basics of why you're in this profession, you truly do it for the love of taking care of our patients and making sure that they are happy.
For sure. Very challenging, but rewarding and super important. Hey, thank you so
Definitely.
much for spending some time with us today.
Thank you. It was a pleasure being here. Nice
Oh,
to meet
good. We'll
you.
have more information on our website at katu.com. We'll be right back with more Afternoon Live right after this.